Well, this comes as a newly issued state report takes aim at Florida's failures to track COVID-19 cases and deaths and how it hampered the state's ability to control the virus and its risk to the public. This according to Florida's Auditor General, who examined nearly a year's worth of state COVID data and found it riddled with errors. Contact 5 investigator Katie LaGrone has more details tonight and context on the findings.
Case data incomplete or inaccurate, COVID deaths reported late or not at all, and contact tracing simply never done. These are among conclusions made by Florida's Auditor General about how the state tracked and reported COVID-19 in Florida. The newly issued state watchdog report, limited to COVID data collected and reported during an 8-month period in 2020, reveals the state failed to include more than 3,000 COVID-related deaths on its death count list. State-run testing sites never returned the results of thousands of COVID tests. And when they did, they often didn't include critical patient information, including race, age, and gender. And remember the state's highly touted answer to stopping its spread.
Testing also goes hand in hand with what we call contact tracing.
According to this report, county and state contact tracers never actually contacted or even attempted to contact more than 20% of positive patients. Its failures we reported on for months.
I still haven't gotten a phone call.
But this report is the first time the state's own watchdog is weighing in, detailing how Florida's undercounting of COVID likely hurt its ability to get it under control here.
It's really easy for people to look at this and sort of interpret it as maybe confirmation of a failure by the state. But is that really fair?
Well, yes and no.
USF epidemiologist Jason Salemi has spent 2 years analyzing the state's data and warns Florida's problem with COVID wasn't unique.
This is not just a Florida problem. Other states in the United States, other countries in the world, they all struggled with this because they were trying to respond to a growing pandemic, and they were trying to do so with data systems that were not primed to be able to respond in an adequate way. So no, I think everybody has had failures and everybody has had successes.
In its response to the findings, Florida's Department of Health disputed some of the conclusions, explaining how the auditor's death count findings was based on misunderstanding how counts are classified. The department also pointed to labs for testing inaccuracies and missing patient information. It noted changes they've made and are still making to improve disease tracking, efforts Salemi says the public should remember as state successes, as much as reports like these shine a light on its failures.
A lot of things we could have done better, but we need to give credit where credit is due.
Katie LaGrone, WPTV News Channel 5.